Good morning, Magee. I have Mell and Scarborough with me today. I do have to confess that my boys got on me because they say every time they watch one of my videos, you say, I am so glad to have this person with me. But in this case, I am glad to have Mell Ann. We've been friends a long time and met through the school, and it's been such an enjoyment. And we've crossed paths in so many different ways. And we have a new way that we're going today. Mell Ann is going to be telling us about the Magee Healthy Heart Clinic. This is a new clinic that we have at the Magee General Hospital located in Tuscan Towers. And Mell Ann, I want you to tell us why this came about.
Miss Sue, in Magee, Mississippi, just like nationwide, we have a large population of heart patients. And one of the diagnoses that we were concerned to look at and try to target and help were the heart failure patients. These patients are challenged with their daily living, and they have a frequent admission rate to the local hospital, and it really challenges their life, and they become depressed and they become despondent, and they don't see a whole lot of light in the tunnel, and they need to be encouraged, and they can be managed and helped with their problems through a healthy heart program for heart failure patients.
Who meets this criteria? You know, you're saying, is this a person who's had a heart attack, might have a heart attack, thinks they're having a heart attack? Who meets the criteria?
The patients that we like to see or will go and target are the patients who have been diagnosed with heart failure. Their physicians have diagnosed them, and they've met the criteria for the diagnosis of heart failure. That usually occurs sometimes after you've had a heart attack. It is sometimes just a chronic disease process of the elderly. You don't have to have a heart attack, but it's a disease process that occurs in the heart for whatever reason. It's usually a secondary thing. It's not a primary thing. But once diagnosed, then we can come in and help them manage that.
Okay, now why do I go see you and I don't go see my doctor?
You're going to go see your doctor.
Okay.
If you are referred for management by the Heart Healthy Clinic, then that is in conjunction with your regular primary physician and your cardiologist. If the referral is made by like Dr. Pruitt says, I think you would benefit from seeing the Heart Healthy Clinic. And I would come in and talk to you, and then I would communicate with your physician, either your family physician or your cardiologist, and let them know what we could offer you. And it's in conjunction with that. You don't just quit seeing your doctor or your cardiologist. You keep seeing them. But you see me as an adjunctive therapy to help you learn how to manage your medications, monitor your weight on a daily basis, and help those things help you stay out of the hospital, keep from going into fluid overload where you can't breathe and you can't, you don't feel good enough to stay at home. You want to go to the hospital because you're having struggling breathing. And we can manage your medications at home, and I can even offer you some medication in the clinic that could keep you out of an admission.
There's more to know about Magee's Healthy Heart Clinic. I hope you'll watch the second part of our interview. I think it's something you'll enjoy and you'll learn. And thank you for listening to MageeNews.com.